Welcome everybody. This is Lessons from the Field. As you know, this is a series of interviews that we do with a diverse array of guests who have a common thread, and that's a passion for pharmacy and pharmaceutical sciences. And today we're featuring Erin Shaughnessy, who's a graduate from our PharmD program in 2003. She is currently Director of Inpatient Pharmacy at Rush University Medical Center. And she's had a very impressive career leading pharmacy departments throughout the city of Chicago and the suburbs since she graduated. So I'm very excited to talk to Erin today about her career and also advice that she has for her students and others who may be listening who are interested in particular hospital pharmacy or health system pharmacy management kinds of opportunities. So Erin, maybe we could just start, if you could just walk us through what you've done in terms of your career in maybe 3 minutes or so since you graduated.
No problem. So I'll try to be brief about this. So I actually started my pharmacy career working at Walmart in DeKalb, and that's kind of how I decided to get into pharmacy. Starting in retail, ended up in hospital, so a little bit different path. But I went from Walmart pharmacy to pharmacy school. And in pharmacy school at UIC, I was able to get a position as a pharmacy intern at the University of Illinois Hospital. So for 3.5 years there, I worked as an IV room technician, working every weekend and holidays and before school, doing OR charges and after school if needed. So after graduation, I stayed on there as a clinical staff pharmacist. I spent a few years getting a wide variety of experiences in the oncology area, in the NICU, in the peds, IV compounding, midnights, you name it, I floated to that area. That prepared me to move into a clinical coordinator position on the south side at St. Francis Hospital, a smaller community hospital. And then that hospital went through numerous transitions in ownership, which within a 2-year period opened up an opportunity to become a director of pharmacy. And I just kind of jumped at that and said, let's do it. As a director of pharmacy, we went through 3 more ownership transitions, and the hospital was rebranded to Metro South Medical Center, which afforded me the opportunity to do a whole bunch of things that I probably wouldn't have got a chance to do otherwise. At one point, the hospital was owned by an independent investment company, so I had the chance to negotiate contracts down to the distributor level and to really dig into all the regulatory aspects. Then it was owned by a very large community for-profit company. So I got to get a lot of system level experience and system contracts and being responsible for 7 other hospitals in the organization. And after about 10 years at that hospital, which was at that time called Metro South Medical Center, I decided to move downtown to Illinois Masonic Medical Center, which is part of Advocate Aurora. And I took on leadership for both pharmacy and the respiratory department. Another really great experience, amazing teams at these organizations, and the new challenge of managing a team that wasn't pharmacy, which really gets you to rely a little bit more on your leadership skills instead of your pharmacy skills, because you can't really jump in and help with a lot of things. After a few years there and some system leadership opportunities in Advocate Aurora, I went and decided to apply to Rush, and here I am now at Rush University Medical Center, Director of the Inpatient Pharmacy with an amazing team around me.
Well, thanks, Erin. And just so that people know, Erin has just been at Rush for 6 months, and I want to congratulate her, and we're happy to have her as a neighbor to the UIC College of Pharmacy just down the block. Also, before I forget, because as people are watching this, they may notice the video is a little bit wonky, and we've had a little bit of technical difficulties, but we're going to keep plowing through, and the audio is fine, so hopefully everybody will follow along. So Erin, we had a series of questions we were going to ask you, and I may mix it up just a little bit in terms of the order, but I thought maybe we could start with, you've obviously progressed very fast from your staff pharmacist role through the ranks of administration and to bigger hospitals as you've gone. Your time at UIC, as a student at UIC, how did that help prepare you for this great career that you've had so far?
So my time at UIC was, of course, crucial. both from being in class and getting to be part of my class leadership. I was class president 1 year, and I was also involved in some of the pharmacy fraternities, but also getting to be a student intern at the University of Illinois while I was in pharmacy school really helped me understand the concepts that I was learning in school and apply them to real life, and really get a very well-rounded education. I had great professors where I could come back and ask questions. And what was interesting too is that some of my professors were the pharmacists that I worked with in the hospital too. So I'd be doing homework after we'd have a slow period in the hospital. I'd be like, oh, wait a second, I have a question on this. Can you help me on this? So it really was wonderful diving into the pharmacy world 100%, both in a work capacity and in a learning capacity.
Yeah, that's one of the things that that I really try to tout to students is those opportunities to interact with folks in the practice setting, but also in the classroom and back and forth because of the great setup that we have at UIC. I think maybe that a natural next question, even though it's not on the list, if you don't mind, is just, we have students who express interest in careers in hospital pharmacy administration all the time. And what advice would you have for them as they go through their program in terms of getting the experience they need to actually move into hospital pharmacy?
I would say start out with getting a good foundation. UIC gave me, both from working as a student and from working as a pharmacist afterwards, gave me a really strong foundation both on the clinical side and on the operations side. Leadership is really going to focus a little heavier on the operations side, so know how your medication makes it from the initial prescription all the way through the automation and dispensing activities in your department to the patient, and then start looking into also what are the other metrics that your department is monitoring or that hospital pharmacy monitors to make sure that the department runs. Specifically, start looking a little bit more into business aspects of productivity, and any experience that you can get in anything business related, if you're going into leadership, is going to help. I did not have an MBA when I originally graduated. I did not have an MBA when I started negotiating contracts and started justifying productivity metrics. I went to ASHP and I read a lot of books. And I went to our finance department at the hospital and I asked a lot of questions and bought people a lot of coffee. I was very lucky to have people who were willing to teach me, but anything that you can prepare for ahead of time will help you in the long run. Going back and getting an MBA, when I was in the classes, I was like, wow, this would have been really helpful if I had done this at the same time as my pharmacy degree, which I know is offered now. Yeah. They didn't have that when I was initially in school, but it would have been really great. So any type of business background.
Great. Well, thank you for that. Yeah, and we do have the option for students to get both the MBA and the PharmD now, and we have students who do that, and it's a great program. So maybe going back then, pharmacy is a constantly changing business. Clearly, if you're in administration, there's lots of new things that get thrown at you, fires to put out. How do you keep on top of your game in terms of, your knowledge and staying relevant as you've moved forward in your career? Are there tricks or any advice you can give for people in that regard?
Well, I think that our pharmacy organizations are a big piece of that. A lot of the continuing education, and even more so the networking that you get to be part of during the continuing education at the dinners and at the different meetings is really important, so that when you do have a question about something, you can reach out to other pharmacy directors, to other pharmacy leaders, or to the drug reps that you meet and say, hey, I've been hearing about this new drug, or I've been hearing about how some hospitals are handling this, and you have those people to talk to and kind of brainstorm what would be a good idea to accomplish a certain task. A great example of this is the pharmacy break legislation that's going through. I know a lot of pharmacy directors have been reaching out to each other to say, hey, so have you guys thought about this? How are you doing this? Are you using a specific software? And just bouncing things off of each other. Additionally, another good thing to get involved with are organizations outside of the pharmacy field. Specifically for me, FACHE, or The organization is ACHE, the American Executive Forum,
Yeah.
American Healthcare Executives.
Yeah.
So they'll make sure that you see the bigger trends so that when you're making decisions, you can say, okay, I'm making sure that our pharmacy goals are aligning with the larger hospital and health system goals overall for our organization and for the company or country.
Yeah, that's excellent advice. In fact, I think of the other guests that we've had, while a number have mentioned networking and so forth, I don't think there's been as specific um, suggestions as yours about organizations and the value of networking in that way. So thank you very much for that. So maybe next question I could ask you is kind of your impact and what things that you think as a pharmacist where we can have the most significant impact.
So I think as pharmacists, we can have impact in so many different ways. On the retail side, you have such wonderful access to patients real time. So I think vaccinations, medication counseling, and teaching people how to really use medications appropriately and preventing adverse effects. And the inpatient side, a lot of it is more talking with our prescribers and making sure that they're utilizing the best medication for that patient at that time, and making sure that we're utilizing only what the patient needs also, because we want to make sure it's the best medication, the best therapy, but also that we're not throwing everything at the patient just hoping something sticks, right? We want to make sure that the medications are appropriate for the indication and we're not overusing our resources. So I think safety from a patient standpoint and also resource utilization are the biggest places that pharmacists can have the biggest impact.
Mm-hmm. Well, thank you. That's a great insight. Next couple questions are kind of advice for others. Maybe I'll just combine these two, but and we always ask our guests what tips they have for those who might be listening, whether it's for work or even kind of life in general. But then also if there's particularly great advice that you've gotten from somebody that you remember that really impacted you. So maybe you could respond to both of those in one.
Well, I would say for advice, one piece of advice that has always stuck with me that I actually got from one of my first directors was that if you're doing great work, make sure your leadership knows about it. Pharmacy does a really great job in keeping our patients safe and in resource utilization and all of this clinical work. But sometimes we do the work internally in the department. Mm-hmm. We need to make sure that that is being recognized not only in the pharmacy department, but outside the pharmacy department so that other healthcare groups such as our physicians, our nurses, our respiratory therapists understand our role in the whole entire healthcare team. So talk to your colleagues in pharmacy and outside of pharmacy. Make those connections so that when you are doing great work, you can make sure that they know about it.
Yeah, that's excellent advice. I don't know if you had anything else. Otherwise, maybe I could ask you next is just in terms of your career, which has been impressive and I'm sure a lot of fun. Along the way, what were the experiences or people that informed you the most or influenced you the most as you progressed through that?
I've had a lot of great support from a lot of different people. When I started out at UIC, the leaders at UIC were willing to let me train in many areas and support me when I had questions and really support the developmental needs that were my goals. If I said, hey, I want to try Schumock, I want to be cross-trained in this area, they're like, great, let's make sure that that works for you and that happens. When I started my leadership role, I had some great advice from CEOs to, whenever you are faced with a problem, take a deep breath, you got this. Unless someone is actively dying, don't worry about it, you have time to fix it. And if someone is actively dying, you have a crash cart, you know what to do. So just make sure that you can go forward, stay calm, and just take it one step at a time.
I like that. I'm writing this down, Erin. Take a deep breath, you got this. I think we need to make a sign and put that up these days.
Yeah, especially with the challenges.
Oh yeah, I mean they're just, especially with the pandemic and all the stress that people are under, and the isolation, also contributes to that, I think. But advice like that, that's critical, and just being able to step back and reflect and take a deep breath and know that it's going to be okay. Just we're going to get through this, and that's really an important piece of information and advice for people. So, Erin, as we wrap this up, let me just ask you if there's anything else that you'd like to convey to those that are listening. We have students who are at all levels of their training, from P1s all the way to P4s, some who are just considering where they might want to practice, what kind of experience they need, and others that are near the end of their education and are interviewing soon for residencies and so forth. We also have recent graduates who listen to this broadcast that are maybe started in their first job and are kind of wondering how do they what's their next step in their career, and then others that are further along in their career. So if you have any last bits of advice or information you'd like to convey, please feel free to do so.
Well, the last piece of advice I would say is, if you're interested in something, ask about it. If you see a position and you're looking at it and you think, oh, that looks really interesting, I'm just not sure if I'm ready, try for it. What's the worst that's going to happen? You might try for it and you get it, and then you're going to have an amazing, amazing time. You don't quite know, but you're never going to know unless you try. And no one is ever 100% prepared for any new position that they take on or any new challenge. Growth is meant to be uncomfortable. So get okay with feeling a little uncomfortable and moving into the next challenge, the next role, the next thing.
Wow, that's all excellent as well. Yeah, I think too often people are hesitant. Maybe they don't feel like they quite have the skills or experience to do something, but you don't get those unless you try. And you're right, it might not be comfortable initially, but once you get the experience and get into it, you realize that you really do have what it takes to do that. So thank you so much, Erin. I think the folks listening are going to take a lot from this interview. It's been great seeing you again. And again, I look forward to working with you in your new position down the street. And Rush has been such a great contributor to our program through the students that we place there on rotations or P4s, and are also, now that we have IPPE and students at all levels rotating through the facility. So it's going to be wonderful to work with you as we move forward. So thank you, Erin.
Absolutely.
Yeah, and congratulations again.
Thank you very much. It was great seeing you again. Stop by anytime.